Okay guys, so that's our equipment check. So hopefully you've got some foam rollers, you've got a tennis ball or some kind of massage ball, anything like that, it will be fine. Some fit loop bands, so that's the little mini resistance bands, and a bigger thick resistance bands like the CrossFit style ones. So if you can get those bits, then you're going to get the most out of this routine. If you can't get some bits, if you can't get the big CrossFit band, it's not the end of the world. It just helps a lot with some of the techniques we're going to do, so we get maximal effectiveness from this program. So that's our equipment. Like I said, it's all pretty cheap to get hold of and it lasts a very long time. It's all very portable, so you can take it anywhere. So that's our equipment check. So what I'm going to do now is we're going to go through and I'm going to show you, because what's important, it's all well and good showing everyone these techniques, these interventions, but we need to know why we're doing them and what are we measuring them against. How do we know we're making progress, and how do we know that we're picking the right intervention? So how do we know that? Well, so I use the overhead squat assessment with all my clients who I see. So that's my top tier assessment that I'll do to see what's happening with their posture, so I can see what deviations they have from ideal. I can see what signs of dysfunction they have. So the overhead squat assessment, that's what I use. I learned that from the Brookbush Institute of Human Movement Science, who I happen to work for. So big thanks to them for teaching it to me, because it's been super useful. So that's what we use at the Institute, and what we all do with our clients. And it's really easy, really effective. We can get a good overview of what's happening. It's not the world's greatest test. There's other tests you can do, but it's what we should start with. It's our starting point, and it's for what we have at the moment, especially where people can't get to gyms, they can't get into clinics. This is a good self-assessment you can do on yourself, which I can show you how to do, and I can show you the signs that you'll need to look out for, so you can almost assess yourself. So if you are having low back pain or knee pain, for example, you can see if you have those signs that correlate with those with pain in those areas, and I can show you how to correct those with the interventions that I'm gonna show you. So, or even if you're an athlete, or if you're a recreational athlete and you feel like you could get more from your performance, you can use this assessment, see where your posture's breaking down a little bit, and again do these interventions I'm going to show you, and hopefully we get it back closer to optimal. And again, that improves your performance. Again, if you do have any pain, we get rid of that pain, or at least drastically reduce it. So that's what we're going to do. You're going to need to film yourself doing it, so we just say how I'm going to do it, because then you can see what's happening from all angles. We need to see what's happening from the front, from the back, from side to side. So like I said, this is what I use with all my clients. It's very effective. There are other tests I naturally would do with clients that we're not going to be able to do, that you need training for, and you actually need someone to do it on you. So, but at least with the overhead squat assessment, you can record yourself, you can see how you're moving, you can see the signs of dysfunction out there. All the signs that we look for are well researched, the reliable signs that correlate to dysfunction and pain, and we've got a lot of research, evidence-based interventions that will help to correct those dysfunctions and get us back to optimal postures. So I'm going to start off with showing you the optimal setup, so what optimal form should be, so how we set up the overhead squat. So what we need to do is we're going to start here. So I'm going to get my starting point, I'm going to work from the bottom and work up. So my foot position should be hip width apart, so that's roughly about 7 inches. So when I say hip width, what it should be is, if you feel on the front of your pelvis, you'll feel these two big bony bumps. That's your anterior superior iliac spine. So that's the front of your pelvis, or I'll abbreviate it as ASIS because it's easier. So you're going to put your fingers on your ASIS, and that should be in line. That should go through the center of your kneecaps and then in line with the second or third toe. So that's where it should be. So feet hip width apart, second and third toe pointing forward. That's where we want to be. Okay, I've already said about the knee should be in line with second toe in the ASIS. So that's how we should be from the front view. So this is just a setup for now. This isn't the actual test, this is just the starting point. So that's what we need from the front. If we turn to the side, I'm going to tuck my top in to my joggers. We put the waistband over that ASIS again, and if I feel I kind of trace my pelvis, it can be a little bit tricky to do. But if you feel around the back of your pelvis, you should run into two more big bony bumps. They're much more narrow compared to the ASIS, but if you find these two other big bony bumps, that's your PSIS, your posterior superior iliac spine. And with the waistband on them, you should be able to see in the camera. You can always get someone else to look at it for you, but they should be, the ASIS should be just slightly lower than the PSIS. We say no more than 1 centimetre. So as long as it's fairly level there, what we don't want is a significant drop. So we don't want the ASIS to be significantly lower than the PSIS. This would actually be an anterior pelvic tilt, which is one of the signs that we see, which I'll talk more about as we go through the test. So we want this just to be just neutral. Okay, so you just tuck your bum under slightly. ASIS slightly lower than the PSIS, and because of that, you should have a slight natural curve in the lumbar spine. That's normal. What we don't want is, if we had an anterior pelvic tilt, we'd have an exaggerated curve. So we don't want that. We just want neutral pelvis. Okay, and then with the spine, of course, like I just said, neutral lumbar spine. Shoulders should be down and back. Okay, and then head looking forward. And then what we do is we also have the arms raised overhead. They should be in line with the ears, and the shoulder blades should be down and back. Now with the upper body ones, the shoulders down and back, I'm not going to go too much into the upper body signs because they're not entirely relevant. One of them is in particular, which I will get to, that's with the arms falling. I'll talk about that in a minute, but I'm not going to focus too much on the upper body signs. I'm going to do a whole other series. I'm going to show you guys how to correct upper body dysfunction. I'll run through the signs of upper body dysfunction and go through and how you can correct it. But we're going to stick with the correcting lumbopelvic hip complex dysfunction, which is the name of this dysfunction that we're going to go after. So that's the one that's correlated with low back pain, hip and knee pain. We're going to mainly focus on those signs. I am going to show you in a sec the ankle or lower leg signs as well, because we need to know, if we do see them, we need to know, because I'm going to show you how you can modify this test to know if your dysfunction is coming from the lower leg or if it's coming from the lumbopelvic hip, and I'll show you how to modify that so you can see which segment it's coming from. If it was coming from the lumbopelvic hip, we're going to do this playlist. If you did this test and you noticed it was coming from the lower leg, you wouldn't watch this series, you'd watch the correcting ankle and flat feet video series that I did before. So that's what we're going to do. But I'm going to talk to you about that in a second. So just to summarize again, just on the setup, feet hip width apart, that's about 7 inches, second toe forward, second toe in line with the knees, ASIS, okay, coming from the side, neutral pelvis, neutral lumbar spine, shoulder blades down and back, head looking forward, and you're going to start with your arms raised up. So in that position, all we're going to do is, it's like a sit to stand. So we're just going to drop into a squat and come back up. If you do half a dozen or so, so arms stay up, you're going to keep the arms up in line with your ears. You're not going to let them fall forward, you're going to try and keep them up. We're going to squat down, up and down, okay. And I'll get you guys to do some from the side as well. So maybe do half a dozen forward, half a dozen to the side. And also, if you face away from the camera, again, do another 3 to 6 reps. And we're just coming down. Okay, so that's the test. Now, what do we need to look for? So let's start at the bottom and work our way up. So I'm just going to, again, I'm not going to focus on the lower leg, lumbopelvic hip signs. I'm not going to focus too much on upper body. So start with the lower leg. The main signs we see, you probably already saw me doing, because my overhead squat is not perfect, I admit it. So I work very hard on it. But with my feet, if I'm squatting down, and if I get this, so this is a common sign, which is feet turn out. Okay, so my feet are starting to rotate out. So my second and third toe are no longer forward. It's now a lot more like my big toe is forward, or worse, my big toe is actually even turned out itself. So I'm going to squat down and I get this position. So my feet start to slide out. That's a sign. So maybe you make a little note of that. The other thing you'll see is I start to lose my arches. So my feet flatten. They start to collapse inwards. So I start losing that position. If you saw my correcting ankle and flat feet video, I mentioned it in that series. So they're the two signs I look for at the ankle. So feet turn out, or in the lower leg rather. So feet turn out and feet flatten. So I would squat down. If you see yourself doing this, see your feet turning out, you see yourself losing that arch, so there's no space there anymore, you can make a little note on that. So maybe on your notepad just write, okay, I've got feet flat, I've got feet turn out. Okay, fine, cool. What else do we see? So if we look at the knees, what happens there? So again, if I squat down, what you'll see is either they might be fine, you know, same with the feet, they might not do anything, they might just stay optimal, that's fine. So what you'll normally see, if there is any dysfunction, you'll see the knees collapse in, so they'll start to bow in this way. It's almost as if they're starting to kiss. They might not go quite as far as that, but you'll see the knees won't be in line with the second toe anymore, they'll be more in line with the big toe, or maybe beyond the big toe. So we'll squat down, we'll start to see the knees come in. The other thing we can see, though it's not as common, but it definitely happens, is knees bow outward. So now the knees are now more in line with my fourth or fifth toe, or maybe even wider. Okay, so if I squat down and this is happening, so it's either knees will bow in or knees will bow out. Okay, again, you just note down if you see those. You might be great, you might have, yeah, second toe stays forward, knees tracks over second toe, no problem. Good, don't mark anything down. But if you do, make a note of it. So that's from the front view. If I turn myself to the side, the signs we're looking for here, if we look at the pelvis, so I said before that we had to have a neutral pelvis, so ASIS shouldn't be any more than about a centimetre lower than the PSIS. It should just be slightly below it. But what happens if you notice straight off the bat that you've got that anterior tilt in the pelvis? Okay, so you've dropped the pelvis, drop significantly, get that exaggerated increase in the lumbar spine in the low back. If you see that, so straight off the bat, this just dropped forward, big curve in the spine, my bum starts to almost stick out a little bit, you can just knock it off straight away. You haven't even got to do the test. But what we do see a lot of is you'd start in this position, you drop down into the squat, and what starts to happen is we start to get that lumbar curve, we start to get that anterior pelvic tilt, so that pelvis starts to tip down, we go into the squat, and again you can see myself trying to arch through my lumbar spine, trying to keep my body upright. Again, mark it off, that's the main sign we're looking there. The other one you're going to see, which is very common, which I do all the time, is when we're squatting down, our lower leg and our torso should form two parallel lines. So if you used to kind of draw an outline of the body in that squat position, it should form the electrical symbol. But what often happens is you'll squat down, and this will happen. We'll have this forward lean. So now my lower leg and my torso aren't parallel anymore. So I'll put a little picture below there in the video so you can see what it should look like. So you can see the two parallel lines. But here you can see that I'm leaning forward. I'm having to throw my center of mass forward. Okay. Because I don't have the flexibility to stay completely upright, to stay parallel. So I know I need to work on it. I'm doing it. So that's another sign you're going to see from the side. Okay. There are some upper body signs that you'll see. So you'll see arms fall forward. I will talk a little bit about that in the modification. I'm not going to go too much into it now. That's, again, I'll delve really deep into it when we do the upper body one, but I'll mention about the arms falling in a second. But for now, I just wanted to be concerned for this playlist what happens here. So I get an anterior pelvic tilt. Does that happen? do I have an excessive forward lean? That's what you're mostly looking for there. Now the other one, and that can happen, this is why we definitely need the video recorder. So we need to use a camera or phone, whatever. We need to see what's happening from behind, because of course we don't have eyes on the back of our head, we can't see. So definitely get a camera. So the main thing we're looking for here is, do we shift to one side? Is there anything asymmetrical? So, you know, it's more common than we realise. So we should be parallel alignment, but more often than not, what does happen from time to time is we start to shift to one side. So you may see something like this. So I get set up, I reach my arms up, and I come down, and I start to shift one way. Okay, so that will come down. So that would be kind of more parallel. I think I have a little bit of shift anyway. You come down, you'll start to go this way. So we'll start to shift over one side. So that's really interesting if we see that. It's really important that we look for that as well. So that's a big sign. Anything, if there is any asymmetry, that's got a very high correlation towards future injury. So we definitely want to address any asymmetry first. Okay, so cool. So they're the main signs we're looking for. So what we need to do now is determine where it's coming from. So this playlist is mainly about correcting dysfunction at the lumbopelvic hip complex, but we're going to do a modification. It might just be the case that the problems that we have, the signs that you've seen, maybe you saw an excessive forward lean, you saw knees bow in, maybe they're not coming from here. They might be coming from the lower leg because we don't have enough flexibility in the ankle joint. So what often happens is, like with me, for example, I squat down, because I don't have enough flexibility in my calf, it won't allow my knee to travel any further over my toe. So in order to make up for the fact that I get blocked here, I have to lean my body forward. So that's very common. So to differentiate, what we can do is, I'm going to use this half foam roller. You can get yourself maybe a couple of these like weight plates, if you've got any of those lying around. If you've got a bit of a home gym happening at your house, or if you've got some books that are, you know, a good few inches, you want to say that's a good 3 or 4 inches thick, ideally. That would be ideal. I'd say a couple of inches, probably 2 to 3 inches. I guess would be fine. Nothing too crazy, but just something that's going to elevate your heels. So what I do, I'll bring that back a little bit. It's the same setup. I'm just going to do the same thing, just but with my heels up. Still going to have my feet second toe forward, hip width apart. Everything else is going to be the same. So if you notice that you had feet flat, feet turn out, your knees were bowing in or bowing out, you notice those things, and you do this front view. So that's what you had on the last front view with your heels down. Now you throw your arms up and you squat down, and almost by magic, you notice all those things go away. Okay. So if you notice all those things go away, okay, you don't have feet flat anymore, you don't have feet turn out anymore, you don't have knees bow in, knees bow out anymore, then that's a very good indication that those signs are coming from the ankle joint. So in that case, you would switch over, watch the correcting flat feet and ankle dysfunction video. If you watch that, I run through all the interventions to correct those issues, which will also correct the knees bowing in, knees bowing out as well. Okay, so that's what you would do there. The same as if I turned it to the side. So now I'm going to really I need to look and see what's happening with the pelvis as well. So if I go back with my heels elevated, throw my arms up, if I noticed before I had that excessive forward lean, which I do personally, and now you guys can see it for yourselves when I do it, wow, now I'm much more parallel. I don't have that big forward lean anymore. I squat down and everything just seems to get better by magic. Okay, so one more time, I'm coming down, you can see my lower leg and torso are parallel, pretty close to parallel. So if that happens with you guys, ankle dysfunction video, go back with that, it's coming from the ankle. What I'm doing here, the reason that is because I'm starting in an elevated position. This is, I put myself into what we call plantar flexion, so that's where I push my foot. This is plantar flexion. If I push up onto my toe, so I'm going to bring my heels up off the ground, So I'm starting here. So all this does really, it gives me a better starting position. By the time I get down to the ground, I don't require my knee to go any as far over my toe as I did without this. So when I come down this way, when I'm squatting down, I need my knee to travel over my second toe. So it's kind of, so this is my foot, my bottom hand, my hand here is my foot, my top hand is my leg. I need the, as I'm squatting down, the tibia, so my lower leg needs to travel over my foot. Now, what happens is if my calves are very tight, they block that. This movement here, so my knee traveling over my foot, is the same relative movement if I pull my foot up off the ground. Okay, so that's what we call dorsiflexion. So if my plantar flexors, my calves, all my calf muscles are tight, they'll block. I won't be able to pull my foot up as high, and also because it's the same relative movement, I can't allow my knees to travel over my foot. So I kind of get stuck here. I can't go any further, which is why I have to compensate elsewhere to get down. So what I've done by going up onto here is, by the time I get down into that squat, I don't require as much dorsiflexion because I'm already in a plantar flex position. So I don't have to. My lower leg doesn't have to go as far in order for me to get as low in this one. So I've just given myself a better starting point. Now, of course, we don't walk around like that all day. I'm not suggesting we walk around in high heels, but all it does is I've essentially just took the calf, or the ankle joint rather, out of the assessment. So I know that if I take the ankle joint out of the assessment, everything gets better, then I know that the ankle joint is the problem. So again, I would go back, watch that correcting ankle joint dysfunction video. That's what I would do. So cool. So that's what we see there. The other modification that we look for, which I said about having the arms up. So if I have the arms up and I've got that anterior pelvic tilt, okay. Now, if I have arms up, okay, so I'm going to come off the block now for a minute. So if I have arms up, so you don't need to be on the block for this. If I have arms up, I have that anterior pelvic tilt. I'm trying to get that arch in my spine. But if I put my hands down now, okay, so put my hands on my waist, and now I'm going to squat down. And then that anterior pelvic tilt goes away. I don't get that big lumbar curve anymore, that big curve in my lumbar spine, because what's happening in my latissimus dorsi, this big muscle on the back of my body, attaching onto the back of my pelvis. If that's short and tight, it can pull the pelvis back this way and tilt my pelvis forward. So by bringing them down, I keep them in like a short position, so they're slackened now. There's no tension in them. If I take them out, bring them down, I now take them out of the assessment. So I know if everything gets better with these not involved, with these big lat muscles not involved anymore, because I've got my arms down, they're not on stretch, not creating tension, then I know that they're the problem. So if that happens, if you notice your anterior pelvic tilt goes away, especially if you've been having low back pain, anterior pelvic tilt is very correlated towards low back pain. If you notice that happens, you bring your hands down, anterior pelvic tilt clears up, then you're going to go and watch my future video on correcting upper body dysfunction, which I'm going to do very, very soon. So you would stop with this series, you would then watch the correcting upper body dysfunction video. That's where you would go if that was the main sign that you were seeing. Okay, so that's our modification then. And what happens if I did heels up again? And remember I said about that shift to the side, that asymmetrical weight shift. Well, what happens if now I go up and again everything gets better, so there's no more shift anymore? Well, if there was a shift without my heels elevated and then there is no shift with heels elevated, then again, remember I took my ankle joint out if I put this on, so that's just a sign that my asymmetrical weight shift, if I'm going towards one side, that's coming from the ankle joint on that side. So if I did this, I was going to the left, so I'm going to come off, sorry. If I went down, I was shifting to the left, I'll go back on the block, I don't shift to the left, then it's going to be my left ankle that is the problem. So again, I'll go back to that ankle video and ankle series and watch that. I hope that will make sense. And quite a few things to do. You might have to rewatch this video a couple of times. The other thing that could happen, though it is very rare, is you could have arms up, you could go down, it might still be there. If it is still there, that shift is still there. And then if you bring the hands down and then you squat down and then the shift goes away, then it's coming from this side, this shoulder on that same side. So it'd be my left shoulder. So again, you'd watch the upper body video and just do it on that dysfunctional side. I hope that makes sense. You may have to watch it through. If you need any questions or anything that isn't clear, please email me. I'll leave my email address at the end. You can just fire me an email or contact me and I can explain it in a bit more detail. So if need be. So that's how we differentiate. Now, what happens if you've got several of those signs? You've got feet turn out, feet flatten, and you've got knees bow in, you've got anterior pelvic tilt, you've got an excessive forward lean, arms fall forward. Where do I start? All these things. So if that happens, you've got all those things, you did the modification, you noticed that you still had an anterior pelvic tilt because that wouldn't go away with the heels up, but all your lower signs got better. So you didn't have the feet flat anymore, you didn't have the knees bowing anymore, you didn't have the excessive forward lean anymore, you didn't have any of that, but you still got the anterior pelvic tilt. Well, start with lower legs, start with the ankle joint dysfunction video, clear that up first, reassess yourselves. Did it get better? So retest. Maybe it gets a bit better. Maybe you notice, oh, it's not as, the feet don't turn out as much, the feet don't flatten as much as before. Or eventually maybe after several weeks or a couple of months, as it goes away completely. Great, that's great. That's all done. There's still that anterior pelvic tilt. Now move up. Now watch this series I'm about to go with you. Correct the lumbopelvic hip sign. So correct the anterior pelvic tilt that we see. You may notice you still have a bit of knees bow in. Maybe that's coming from here. Maybe the anterior pelvic tilt is still kind of the restrictions around the hip joint are still contributing to the knees collapsing in. Fine, we go up, we've corrected here, we've got the ankle better. Maybe we're not leaning so much forward anymore, we're kind of sitting more upright because we've been fixing the ankle joints. There's still some problems around here. Fine, that's done now, we've fixed that. Now we can work up, now we can start working on this. So always start from the ground up. If something's really bad, if you notice that feet flatten a little bit, feet turn out a little bit, there's somewhat forward lean, not terrible, it's not as bad as mine, but there's quite a crazy anterior pelvic tilt, or you're getting low back pain, that's the main complaint. If that's the case, if that's what's going on, this is clearly like a big problem, this is really causing some discomfort, then start here. Go for what is causing the complaint first. Definitely go for that, then you can go back to those signs later on. So I hope that makes sense. If you want me to reiterate that, again, just send me a message and I can advise on what you need to do. But hopefully that gives you guys some things to look to. So like I said, in this video, I'm going to focus on how to correct the lumbopelvic hip complex. So I'm assuming in this video you've done your overhead squat assessment, you had an anterior pelvic tilt, you did your modification, you had knees bow in or knees bow out, or you had a weight shift that didn't go away with the heels elevated. All signs that the problem is coming from here. Same if you had an excessive forward lean, it didn't get better with the heels up, it was still there. That's a sign that, again, that problem is coming from the lumbopelvic hip complex again. So if that is your case, if that's what's happening, if you're having low back pain as well, do that assessment, and if you see those signs, it doesn't get better with the heel rise, you're going to watch the lumbopelvic hip complex series, which I'm about to do. Okay, so again, any questions, anything you want me to clarify? I know it's a lot of information to take in, but I'm hoping that with this, it just arms you guys with an assessment you can do at home. If you can't get to a clinic or you can't get into a gym because it's difficult in a minute, Here's an assessment that you can do, and you can see how your posture's doing. If you notice you're having pains in the knee, or if you're getting it in the low back or in the hip joint, you can do this assessment and you go, oh yeah, I've got some knees bowing, I've got an anterior pelvic tilt, and I've noticed that, okay, so, and now I'm going to watch this series because it's going to show me all the things that I need to do to correct it. So I'm hoping that's my intent with this video. It just gives you guys a bit more clarity. You can see what's going on, and the great thing as well is you can reassess yourself. You can do another video, you can just track your videos or track pictures over time, and you can see how it's got better, or if it doesn't get better, then maybe we need to try something else. Maybe, you know, you could always message me and say, I'll try this, it didn't work, any suggestions? I can give you some other tips that we can go into. But yeah, hopefully over the course of the weeks you'll see a nice improvement. So thanks for watching. So I'm going to continue now with correcting the lumbar-pelvic hip complex, and we're going to be starting with the release techniques in the next video. Thank you.